Welcome to our audience for the Business Matters podcast. We're doing this from the Win Technology studio here in the Chamber office. And of course, we want to recognize our Paragon sponsor, Royal Credit Union. Thank you very much to both of those strong supporters of the Chamber and all we do. Today, I am very pleased to introduce to you Dr. David Usher and his wonderful practice and business, which we're going to allow him to kind of explain and go over. But I also want to highlight they were just this year's recent Small Business of the Year at Bravo to Business. And so, David, congratulations. But let's start off a little bit of your story. How did this become? I mean, what was it in your life that you decided to break away, we will say, from the system to create something brand new?
Thank you, Dave, for having me, and thanks to the Chamber for a really fun award. My team really deserved that kind of recognition. They bust their tails doing really great stuff for us. So, man, that was nice for them to get recognized that way. My name is Dave Usher. Of course, I'm a family doctor, and I came out of residency in 1996. Which is where you get trained as a family physician. And I spent a couple of years in Kodiak, Alaska, working for a Native association there, the Kodiak Area Native Association. And after that, we decided to move back closer to home. And Eau Claire was a place I had actually spent a month at then Luther Middlefort. And so we decided to come back this way. So in 1999, I started working with what was then Luther Middlefort. And that evolved over the next 12 and a half years from to Luther Middlefort Mayo Health System, and then eventually Mayo Clinic kind of put their three shields on it and called it Mayo Clinic Health System, and it is now what it is today. As a physician, it's always been a little bit in my nature to be, I don't want to say disruptive, but curious about why things are and how can we make things better and more efficient and so on. And so over my 12 and a half years with the Mayo Clinic, I was involved in committees, Six Sigma training, lean management. I helped start the customer service department. I was training employees at all levels in customer service and so on. I won't call myself a political junkie, but I do follow at least national politics, if only for the entertainment value. But at the time, so in 2009 and into 2010, I was following along as the Affordable Care Act legislation was being discussed and evolving and so forth, and I could see kind of at every step that what was going to grow out of that, economically speaking, was basically a supply and demand issue, right? So knowing that if you require all these businesses and all these individuals to buy insurance and require them to give away, it's not giving away, but to provide free physicals and free preventive things and all these things that have a $0 cost. Assuming that people took advantage of that, which naturally they would, that would mean that the premiums for insurance were going to go through the roof. And knowing, again, economically, there's nothing an employer can do to absorb all that cost.
Right.
Very easily, and they would have to cost shift to their employees, and therefore deductibles would start to climb, right? And the deductibles start to climb, and suddenly what's marginally affordable in healthcare now becomes unaffordable. So when you're seeing people for routine diabetes care or high blood pressure or depression or asthma or things that are very common, and when you want to order routine things on those people, like spirometries and lab work and so on, that just becomes incredibly expensive. And we know, well, I learned in my 12 and a half years here that Western Wisconsin is one of the highest cost areas in the country for healthcare. I think Indianapolis is probably the only focal area that's more expensive than this region. So what I could see is that my patients already, we would have to have conversations about delaying care, deferring care because of the cost of things. And this was only going to make that worse over time. I thought, I can spend the next 20 years of my life talking to patients about why they should try to afford this instead of some other thing that they really want to do. Or I can step out of the system and do something different that allows people to give them some power back,
Sure.
right?
Yep.
Right. Maybe I'm not going to cure their asthma, but I can make it less expensive to care for it in a good, high quality way. So, at about the time that, literally on the day that Obamacare or the Affordable Care Act was signed into law, I learned about a model of care that was doing exactly what I wanted to do, which is cut out all the insurance billing, the Medicare, Medicaid, all of the third-party payment system that would then allow for me to open a practice with myself and literally one medical assistant.
Okay.
And she would answer the phones and draw blood and room the patients, and I would see them and prescribe therapy and so forth. And that is how we started. We were in those days we were charging $55 for an office visit and an associated lab work and so forth. And that's kind of evolved now, figuring out kind of the model and so forth. It's more expensive than that, but still a really great deal, relatively speaking. The other thing that I knew at the time would really make this work was the fact that I was specialty trained in obesity medicine.
Okay.
And I had some experience, again, at Mayo Clinic with their weight management center. And alongside of that, or in parallel with that, I had begun to also dig into obesity medicine kind of as a specialty, and got to see a really broad scope or broad perspective on that. So I started seeing some patients who were in for primary care, but I could see their primary problem really was not blood pressure and not diabetes. It was their body weight.
Sure.
So we started treating them specifically for obesity, saying we can either put you on diabetes drugs or blood pressure drugs, or I can put you on weight loss drugs and put you on a diet. And to help you stay on the diet, we use the weight loss medicine. So people started losing tremendous amounts of weight. We started working with the gastric bypass team as their pre-surgical weight loss program, and some of those patients would lose so much weight they didn't need surgery anymore.
Oh, my goodness.
Yeah.
Wow.
That was really successful. So I knew if we stepped out and offered primary care alongside medical weight loss services that we could probably make a go of this weird business model for primary care. And 2 years after opening, then I had a contractual arrangement that required me to work 25 miles from my previous location. So I opened in Menominee.
Okay.
And Dunn County is not a very wealthy county. It's probably among the lowest median household incomes in the state. And knowing that we could make it work in Dunn County, I thought this can probably work anywhere.
Sure.
That anybody wants to be sensible with their finances. So after 2 years, while we were getting really busy in Menominee, I had to make the choice to come back to Eau Claire because it was closer to home, frankly. And so we closed the Menominee office temporarily. I mean, we closed that one. Came back to Eau Claire in 2013 and started doing what we do here. And the way we do things has evolved a little bit, but since then we've grown from myself and medical assistant to a staff of about 30 people, 8 or 9 providers. Now we're offering some psychiatric services with a nurse practitioner, and we're looking at bringing on a psychotherapist and so on. So there's some it's just really evolved. They're finding what the needs of the folks are and
Sure.
trying to offer that at a price point that they can afford is still kind of our goal.
So one of the issues in our area right now, of course, and I don't want to go too far off in this, but is workforce, is finding bodies. Because you have such a different model of somebody going through medical school and, you go to a hospital, you work for them, do you find it hard to attract clinics, doctors, nurses to what you're doing versus maybe where they thought they would be going?
That's a really great question. There's a couple. There's the direct answer, and then there's also kind of a side note I'll add on. One is what and as I was just explaining to your producer Chelsea here, it's probably about every week or every other week now I have a physician, a nurse practitioner, a PA, somebody reaching out to me saying, "Hey, do you have room for me?"
Okay.
Providers are so, physicians particularly, whether they'll say it directly or not, many, particularly in primary care, are so burned out by the system. It's probably, I'm going to guess there's 75% of providers will admit to burnout.
Okay.
In some form. The heavier lift we have in some respects is not the providers so much as the medical assistants, medical receptionists, and that type of staff.
Sure.
And that's been a bit of a struggle. And so we've been kind of muddling through that, and we have some turnover now and then. But generally, once you get people in, we have a way of interviewing people to make sure they kind of fit our core value framework, right, including that financial piece. And so we've been pretty successful at getting people. We've had just last week, prior to the award ceremony, the day before the award ceremony for Bravo to Business, we had a Employee Appreciation Day.
Okay.
Which is the first time we've ever taken an entire day off, closed the clinic, everybody got together, and we had, so out of 30 people, we had 7 or 8 people who had been with us for over 5 years out of 11, and a couple of people who've been with us for 7, and several who've been with us for over 10 years now. So our turnover has been pretty low. We've been really blessed with that. So what that says to me is it's a fun place to work, and our employees find what we do valuable also. I think that has a lot to do with that. They just know what we're doing is meaningful. So this kind of goes back to your first question, but it's also speaks to that workforce thing. One of the things that we started doing 9 years ago now is working with employers on a membership type basis or direct primary care basis. And so that, from an economic development standpoint and from a recruitment and retention standpoint, if the patients understand, if the employee, or if it's a guy, the employee's wife, understands the value of that kind of, we call it near-site clinic model or direct primary care for employers model, where people can go in for $0 or, very, very inexpensive office visits, depending on their plan structure. They can go in all they need to, and they can call us, and they can text us and portal messages or whatever it is that they need to do. We don't have to drag them in and bill them for things because they've already paid us. Right. It's like a cell phone membership. So that is, and one of the benefits of working with us is you're free to use one of our providers for your primary care for your family if you're comfortable doing that. Not every employee is, but most of them are. And and they recognize the value of that. If they go over to one of the big systems, they're liable to run into a huge bill, and if they can see our people for free, wow, that's a lot of extra benefit for them. So anyway, so that recruitment and retention, so that's what just reminded me of the employer side of things, because that's really a big thing. They're the employers that we work with, there's about 20 of them, and they're 21. And their people really love it because they know they can get in today or tomorrow, and it's just going to cost them next to nothing or nothing at all.
So if I'm an employer out there, what kind of employee count do I need to maybe take advantage of that type of program?
Our smallest employer right now is probably, I think, about 12 employees. And our largest one is, people on the plan, let's say, 25 people on the plan. No, did I say 12? 12 people on their plan. Our largest is 1,400, almost 1,500. We've got a number that are up around 1,000. and then a number that fall into that 100 to 200 range.
Okay.
So the best fit for doing that is to be in a self-funded or level-funded plan where you can see some benefit from the cost savings that you get when you're fully funded. That can be beneficial as well, but in a different way. It can kind of help flatten your premiums out. But a self-funded company or self-funded like the Chippewa Falls School District works where we do their on-site clinic for them. Millions and millions of dollars they've saved with us over 5 years.
Okay.
Yeah, we just celebrated our 5-year anniversary with them. That was fun.
That's great.
Yeah. A low-carb breakfast. Actually, there were probably some donuts there, but I don't think anybody ate them. I think they all deferred to me and didn't go for the donuts.
Well, at least while you were there.
Right, while I was there, yeah. We left it all behind, so who knows what the
football team came in shortly after.
Right,
and
hopefully
those.
that's who ate those, yes, those guys who would go burn that off right away. So anyway, it's a big range, and that can scale up to, there are big companies that have been doing this for years. Ford Motor Company, for example, they've had on-site clinics for years and years. And we have the one on-site clinic at the Chippewa School District, and otherwise it's near-site clinic stuff. People use us as their near-site clinic, and rather than having to the word's not collaborate. Rather than collaborating with a bunch of employers to try to get together enough people to be their own shared site clinic, they can just work with us directly, and we can be their near site clinic. And then they have all the options of all of our providers, all of our locations in Hudson and Menominee and Eau Claire, and soon to be Lake Cali. We're opening another location at the Village Shops of Lake Cali, so we'll be next to Shopko Optical, if you all know where that is. Yeah. Aldi, across from Walmart.
Okay. And when will you be opening that?
We're looking to January of 23.
Okay.
Yeah, construction is underway.
Okay.
Yeah.
So again, the next, I guess to me, the next logical question, if I'm a business sitting here listening to it, what is the starting point for me? Do I contact you? Is there someone on your staff that can kind of take a look at what as a business owner, what I'm paying, what my employees are on, to what you could do for that?
Right. That's a wonderful question. We are, as always, a higher level answer to the answer you're asking me.
Oh, yes.
To provide. We have experience working with some brokers and advisors, but we have evolved to the point where we basically tell the employer, and we'll tell brokers, advisors, consultants, whatever, get us in front of the employer first. If you want to meet with us, you want us to give you a quote, we need the employer in the conversation. So a lot of employers will come to us directly, and they can reach out. I mean, if they come through info@ReforMedicine.com, it'll come to me, and we'll get them. Diane Peterson is our chief in that department. Let's call it sales and marketing, and she is kind of the linchpin point. But generally, the two of us will sit down with the employer and look at what they're doing and talk about that.
Okay.
Some employers will bring their broker advisors along, and some won't. They just kind of, but we think of it as a doctor-patient relationship with the employer, right? Yeah. Who they have around them helping them do what they do is fine, but I want to look them in the eyes and say, tell me where it hurts, right?
Yep.
And then we can tell you how working with us might help that. Some brokers, advisors are really good at explaining what we do, but a lot of them still don't understand all the nuances of that, and we'd rather present that to the employer ourselves rather than go through an RFP process or something where you don't get a direct conversation with the employer, because their employers generally recognize the value of the people who work for them, and the really good ones really just love their people, right? Yeah. They just want to provide the best they can possibly provide, but there's always a limit on the money, right?
Right.
So when they understand, when we can have that conversation with them and get them to recognize that when they're paying us for primary care, that's it. There's no There are no surprises with us, right?
Correct. Yeah.
And so, and we don't. We're completely independent. We have no relationships with insurance agents. Nobody's paying us to sell something. We don't pay them to sell us. We don't pay commissions to anybody. It is truly just you and me, the employer, and ReforMedicine trying to get the best value we can for your healthcare dollar. What employers need to know, and sometimes not everybody at the table understands this. There are just kind of standard ways of counting and measuring the value of something, and what often pops up is, if we pay you this amount of membership dollars per month, how's that going to compare to what if we paid for those same services somewhere else?
Mm-hmm.
And often that's about the same.
Okay.
Right? What they don't recognize, or what that type of calculation doesn't recognize, is that by providing that membership, people who on your current plan are medically homeless because they don't want to get surprised with the medical bill.
Sure.
Because they've had terrible experiences with what's called the system in the past. They simply won't use the health care that you're providing. You're providing insurance. You're not really providing health care.
Yep.
When you pay for the health care already and people can use it, it's kind of like a cell phone. You can talk and text and unlimited data and all these things. Or you can, look at your cell phone once a day and see what the date is, or check the weather.
Yep.
Doesn't matter. But it's available to all the people equally, right?
Sure.
So if they need to come in over and over and over, we'll see them once a week if we have to. Or I tell employers, I'll see your people every day if we need to, if that's what it takes to get them under control for something. Never happens.
Right.
But we could,
right?
And it would cost the patient very little or nothing, depending on their health plan. I keep saying that if you have an HSA in place, we have to charge something so that they call it fair market value, but we have to charge something so that people don't run into trouble with their personal federal taxes.
Sure.
Right?
Yep.
Because of the HSA and the way it's structured. But so under this approach, it's almost best to not have an HSA. Just take all the money you're not going to spend against your deductible and put it in your bank account, and there's your HSA.
There it is. Okay.
Yeah.
So again, as we talk often around here, 68, 70% of our 1,200 investors are 25 employees or less. And again, pre-Obamacare, there were plans across the country that allowed chambers to cooperate together to offer health insurance plans to their members. Is there anything today through you or something where maybe 3, 5, 10 businesses that maybe have 8, 10 employees could come together under one system? Or is it really they're still left out there that's not an option?
I think that's a possibility. What we have not done, here's the higher level answer again. There's a concept out there which has taken hold, and there's now about 60 of these practices across the state, called direct primary care practices, where a family physician, usually a family physician, might be an internist, but a physician opens a practice and says, all we're going to do is take memberships. And it's pretty easy. You give them a credit card number, and every month your credit card gets tagged for whatever your membership dollar amount is, and that is variable across the country. It might be $75 a month or $150 a month, depending on where you are and where you live. But people can sign up as individuals, right? You can sign up as families and so forth. When we start dealing with employers who are paying us directly and so forth, very often there's a backside to that where if their broker, particularly if there are brokers involved, they'll want data, utilization. Are we getting a good, is this a good deal? And so there's some administrative costs to dealing with that and uploading and knowing who all those people are, which is why we haven't gotten down to that 8-person group very much.
Yep.
And we just haven't developed, I guess, a sales approach for that number, because really the market's developing. When you explain to people, like I'm sitting here explaining it to you, it literally could be 100 conversations like this.
Right.
And so we've not focused on the smaller employers. Mostly what we tell them is tell your people to come here on a fee-for-service basis. They'll save a fortune.
Sure.
But so when people want to come together on the shared plan like that, whether they would form a co-op or some other type of group and come together with one spokesperson and say, okay, here we're going to bring ReforMedicine 200 patients. That would be easier for us to do, because
Sure.
it's one conversation instead of 10,
Right.
So that could be how that would go.
Okay.
We haven't seen that happen. We have seen multiple employers in one location come together. We come in and explain to them all what they do, and then they decide whether they can work together and so forth. And I know that model exists around the region, but there's just hang-ups with that, because everybody's owned by somebody, and those, even though the people on the ground know that this is a really great thing, they have to explain it to an owner who's halfway across the country, and so that can get a little dicey.
Okay. So you split yourself from the system. You've been doing this now about 12 years or so. You're a very strong investor and participant with the chamber. Why do you think that's important for businesses to invest in the chamber and be involved?
Oh, the networking, just who you meet. Across the spectrum, right?
Sure.
Just from financial is what I think. I was always running into bankers, right? There's bankers at everything. But just kind of keeping your finger on the pulse of what's going on in the community and listening to, you get to see what some of the health systems are doing, which is kind of nice. Just kind of understand what the pulse is, market research, all those things kind of happen. Of course, once in a while you get recognized with an award, and that's really great. Get some cachet out of that. And mostly it's just fun.
Right.
When you get to show up at things with people, it's just a ton of fun.
Yeah. So when I look at, you made a comment earlier about the cost of healthcare in our area. Yet when I look at the providers, let's say, we're certainly not lacking when, we have Mayo and Marshfield and Prevea and HSH and, all of them, Oakleaf and everything. Do you see them as competition, or because you're really doing, in my eyes, something that's really different in a way? How do you view that?
First of all, we have great healthcare in this region. The hospitals are great. I would have no problem. Take me wherever here.
Right.
If you find me on the street, take me to the closest hospital. That's fine. They're all great, right? They're all good. The way I try not to get too political in this, but if you think policy-wise, the way I think of it is, this legacy system we have is built around how Medicare pays for stuff, right?
Right.
Who's going to be getting sick the most? Well, it's the elderly population, the people who are older and have chronic health problems and so forth. And so that whole system is designed around taking care of the oldest, most at-risk, sickest people. And because a lot of that money flows out of the federal government, it doesn't come without strings, right? So there's so there are accreditation bureaus, the Joint Commission, just Medicare itself, CMS itself. Everybody's looking over your shoulder to make sure you're doing everything exactly the way you need to do it in order for us to pay you.
Right.
Right. So there's a huge cost burden to those organizations to be able to play in that sandbox, if you will. From our standpoint, the way I see it is basically we've created kind of a parallel track I talk about like train tracks, right?
Sure.
You've got in the U.S. we don't have much for passenger trains, but it's like having the Amtrak over here. It's kind of the old reliable. It may not be on time, but it will show up eventually and get you where you need to go. And there may or may not be a bartender. But what we're trying to do for the people who aren't on government insurance is create something that looks more like the European train system. Kind of get on, shoo, off you go. It's efficient,
Right.
fast, inexpensive, and it will occasionally pull into the same station as the Amtrak. That's the hospital.
Yep.
But everything else that doesn't require an acute care hospital to accomplish, for example, advanced imaging, let's say MRI or CT scans, because those are in a hospital setting, I think they get reimbursed at a much higher rate than if you move them across the street and call
Sure.
it an outpatient center, right? Same study, same organization,
Right.
doing the exact same thing, but because it's done attached to the hospital, the reimbursement is different. Well, what's up with that?
Yeah.
Why is that? And so basically everything that we can do to help lower people's costs. And so if you don't have any insurance and you walk in there and you kind of get that full price
Ooh.
and so on, ouch,
Yeah.
right? So there are things that people need hospitals for, and we love the hospitals here, and when we have to send them there, we do. But knowing that there's just that price differential, I mean, just within the system, it's crazy, and you don't.
Right.
There are books written about this. So I don't see them as competitors so much as what we're just trying to create is a system that will allow the people who aren't those really high-risk players who bounce in and out of the hospital a lot or who are going to need the hospital a lot. When somebody has appendicitis, they need their appendix out, right? They
Right.
need the hospital, they need an OR, they need great surgeons and anesthesia and so on. But if you can detach from that and kind of give people that transparency of pricing and so forth. I've been doing this for 11 years, and I've seen efforts at more transparent pricing and so forth, but it just tends to go away. I think it's very hard for the system to be free to do that because they're bound to Medicare.
Sure.
And that ultimately, if people ask me what the ultimate problem is, I'd say, well, it's the fact. It's just the way Medicare is structured.
Sure.
You know, how well-intentioned it was, it's created this.
A lot of what you said today, if not all of it, kind of emphasizes for me that today it's more about being an advocate for yourself in healthcare, understanding you have choices, and not in a negative way, but questioning your medical doctor, people, whatever. I mean, again, I'm old enough, and looking at some of your gray hair, I'm guessing we're not too far apart. You know, I was fortunate that our family doctor lived next door. So every time I needed stitches, that is exactly where I went. You know, we didn't go anywhere else.
Right next door.
You know, and all of that. But we never questioned. You know, if he said, you do X, you do it. You know that
Right.
was the way. And so I think part of what I see is a generation of my age, maybe a little bit younger, but asking those questions. Do I, you know, if they propose this test, well, is there something in between that isn't quite as expensive, or
Exactly.
some far away or whatever, or is there some place I can? So I commend you, and I don't know there's a question, but really I just think it part of this is I think you're providing an education to people too of there are alternatives. There are ways to get that medical need you have without maybe a traditional you just go in blindly sometimes.
I think that's exactly right. Your point is a very good one. What we do with transparency of pricing, we also try to do with what is going on. What's interesting is there's so much medical information out there, right? WebMD and
Right.
Mayo Clinic's website, and everybody's got a website, and everybody's got all this information out there. But there's no transparency in pricing, right?
Right.
So people, and honestly, every week I see probably several patients who tell me if they hadn't looked something up on the internet, they wouldn't have gotten so worried and then decided to come in. Because they weren't really that bothered by something, but they read on the internet that it could be, some rare thing or unusual thing for their age group, or they're just very low risk for that one weird thing. But they read about it, and now they got to come in and make sure they don't have it, right?
Yeah.
But what you can't find is transparency of pricing in the system of healthcare almost anywhere, other than the places that are setting themselves up to provide that transparency. I mean, an MRI provider, for example, right here in town, soon to be another, will tell you their MRIs are $595, $650. Like, wow. And that's it.
Yeah.
Yeah. I mean, you try to call one of the hospitals, and again, it's not their fault. It's the way the system is set up,
right.
With insurance based on discounts and all these things. And it just gets really murky. So that transparent, and so people come in and they have a knowledge, just an amazing knowledge, really, of what's out there and what's possible medically. COVID-19 pandemic kind of pushed that along a lot, right? We started hearing about different virus types and the antibody types and all these things, different types of tests, the PCR versus the antigen and so on. I mean, people they have the opportunity to have an entire medical education right there in their phone, for goodness sakes.
Yep.
But ask what the price of this test is they want. Crickets, And so it's fun to play that role for people and be able to help them understand. Number one, you probably don't need an MRI. Or maybe you don't need that today. If this doesn't get better, maybe we'll get it next week, or something like that.
Yeah.
But number two, if you do need it, based on what your financial situation is, we may send you right over there, or we might send you somewhere else because you're going to wind up paying a lot less if that makes sense for you to do.
Yep. And I think, as you said, too, and I don't want to go too far down this rabbit hole, so after this I'll stop with it. But to your point earlier, I had a traumatic accident back in 2015 and spent many days in the hospital. But I also learned with my in the trauma center with my neurosurgeon and trauma surgeon, they both got out of practicing day to day because a lot of the tests they were ordering and the things they do, they never knew how much it cost. That was, again, practicing at their age, that was just the way they did things.
Right.
And so they were trying to do, but both I remember telling me clearly that the reason they got back into trauma was that's one room in the hospital that the government can't dictate really. Do you stop and take a pre-qualification?
Right.
It's like if we, and so again, I just always remember those conversations with them, and I thought, how did we get to this point that, so much qualification has to be done by somebody who is not in the medical field, and we're being controlled. So, so kind of get to the wrap up. Trying to get to the wrap up with this is with me is always an interesting thing. To you, when you look at your business, the community, and everything, what is business to you? I mean, what when you looked at what you were doing, you wanted to provide alternatives. You wanted to provide a better service. But as you look at the business community of Eau Claire, how would you define it?
The business community of Eau Claire?
Overall, yeah. Just when you step back, and I'll give you maybe trying to explain a little bit better, is that when I came here, I was really astounded at the level of cooperation, of collaboration in this community versus where I came from and almost, I would say, many other communities. When I look at two very large construction companies, both working on the same building to get it built, things like that. So when you step back and look at the various businesses, one that you work with, but even that, how do you view the area? Why here?
Well, I would say, in my experience, what I love about here and the employers that we work with, generally, they're very people-centered.
Okay.
I think Eau Claire is a community which I don't want to say it's a small town, but it feels small and in very many ways. And if you if you engage it, it can be really engaging and warm. And but like when we first arrived, it took years for us to get to know somebody. It was
Right.
The people I worked with. But we had little kids and we weren't out going to lots of functions. It just felt like it took a long time to get to know people. But once you get here and get involved in things, holy man, it's a really warm place to be. It's a great group of people, and the employers that we work with just care so much about their people. That's what's so much fun to work with these groups. And once you start, and through chamber events, you get to know people, and you start to see how even people you've never met, but you watch these award ceremonies and so forth, and people are just fabulous around here. So warm is what I would say.
Okay.
And I don't know that I get to see directly the cooperation among businesses. I know there's lots of charitable stuff and so on that goes on. But you start seeing the same people over and over, and that's just a ton of fun.
Yeah. Well, good. Okay. And any final comments you would like to make to our audience today before we wrap this up?
Well, what I would say is if you haven't felt like you have the power in your healthcare equation, you have more power than you know you do. But always question. Trust no one in healthcare, not even me. No information from your doctor no news is not good news from your doctor. It just means that somebody didn't give you the news.
Sure.
So if you, just trust no one, ask lots of questions, and if it seems expensive, there's probably a less expensive option for a lot of things. But you're right. Some things somebody's going to have to pay for it because it's a big need and a big ask, and you need it now.
Yes.
So,
yeah.
Our hospitals are great. Our systems are great. We're just trying to create a little parallel track to lessen the cost burden for those people for whom it makes sense.
Well, and again, I think it's any business, anything. It's an option.
Right.
And as a business, you have that option. Do you want it? It's there. We never have enough of what we all need. So this just provides that service to those that are truly interested in it. So, David, as we wrap this up, my final question is, as part of what we do with this, is why does business matter to you and to ReforMedicine?
Well, business at its root, basically, is people trading things of equal value, right?
Mm-hmm.
And that's the free market. And so what I have found over my 11 years is that both employers and the people they provide healthcare for and our patients who just pay us on a direct pay fee-for-service approach are very willing to do business with their healthcare provider.
Sure.
They're very willing to pay for things if they don't feel like they're getting bamboozled.
Okay.
If they know what the prices are and they know there's a stopping point and they can control that.
Okay.
I could have those 8 labs, but I can only afford 3 today. So which 3 are most important, Doc? These are the 3 I really want to do today then. And they'll be happy to pay for those because they know it's valuable.
Right.
Right. And because of our time structure, our appointment structure, and we have longer appointment times, we have time to kind of explain why that is the case. Why would you get these 3 and not those 5? Well, I would really like to get all of them, but these 3 really are critical today. Okay. And they'll go with that. And people are really willing to pay something for their health care. I don't think people want things for free that they really value.
Right.
They know that this is valuable, and if they can pay something for it and get a good deal, I think they feel good about that. And as a physician, a healthcare provider, frankly, that there's dignity in that.
Right.
For people, right?
Yeah.
To be able to pay something towards something that they value, and get what they want. And both of us have a satisfying experience. And so being that side of the business matters for me. That's the piece that really makes it valuable, is knowing that people are willing to contribute something to their own health And frankly, when they do, I think they get better outcomes because they feel engaged, and frankly, they've got some skin in the game.
Sure, absolutely. Very good. Again, I want to thank our guest today was David Usher with ReforMedicine. And again, as we talked, they were just honored at Bravo to Business with Small Business of the Year. And so thank you for coming and telling us your story. And I just, again, would encourage any business out there that would like to learn more, reach out, contact David. And it sounds like we can do those through your website and see if maybe that's a different fit for what you're doing for your employees today. Because, again, as we look at workforce, keeping people, as we're learning faster, is much more or less expensive than keeping that turnover going. So
that's exactly right. Yeah. Providing them health care versus merely health insurance.
Health insurance.
That's
very
really
good. Very
the
good
way to describe that.
So, David, thank you very much. And folks, hope you enjoyed our show today and look forward to our next edition of the Business Matters podcast.